Hi, welcome everyone. I'm Steve Buick, the Press Secretary to Tyler Shandro, the Minister of Health. We're here to announce the release of the review of the province's continuing care system. We have 3 speakers today, and then we'll take questions after. We'll begin with Minister Shandro, then MLA Richard Gotfried, and then over to Dr. Carol Estabrooks as our final speaker. So with that, I'll ask the Minister to get going.
Thank you, Steve. And good morning, everyone, or good afternoon, I suppose. It's afternoon now. And I'm so excited to be here to make this announcement. This is something that I've been working on since becoming Minister of Health, and so excited to be announcing this report and to be able to speak to this today. With me today, as Steve mentioned, are Richard Gotfried. He's the MLA for Calgary Fish Creek, and as well Dr. Carol Estabrooks, who is a professor of nursing at the University of Alberta and one of Canada's leading experts on continuing care, who served on the review panel. And I want to thank all of you on the line for joining us today. Governments everywhere are looking at strategies to modernize and transform continuing care. People have been talking about this for quite a long time without a lot of action, and in particular in the last year and a half with COVID-19, it has brought a spotlight to folks who are working in and residents of continuing care. And so we started that work before the pandemic hit, as I said, and obviously the experience of the last year and a half during the pandemic has made it that much more urgent. And it's complex work, and it's deeply personal to every family in the province, including my own and Emily Gotfried's family as well. My Baba, before she passed, as well as my grandpa, were in continuing care before they passed away. And my dad, as well, is a home care client. And whenever I consider a decision on continuing care, I think of what would be the right thing to do for them, because every family deserves the same high standard of care throughout this province. So this has been a priority for me, as I said, from the start. We began this work at the end of 2019. I announced in February of 2020 that we would be doing a review of our legislation on continuing care. And then the pandemic arrived in Alberta, and we expanded the review to look at how the system performed and how to learn from the pandemic and how to make it better, how to make it safer. The pandemic took a terrible toll on our continuing care residents and families, as well as claiming 6 of the dedicated staff who care for these residents. I've promised that we will honor those we've lost by working to improve the system. And this review is the key to delivering on that promise. Now, I asked my colleague, MLA Richard Gotfried, to lead the review because he shares my commitment to the system. And his report and the entire process have reflected that commitment. It's just a tremendous credit to him and to all 15 members of the review panel. Their expertise and their advice was integral to the review process. And now the review looked at how we can build on the best aspects of the system while making meaningful changes that position us as a province for the future. And today I'm happy to share the final report, which Albertans can view online at alberta.ca. And this report makes 42 recommendations that would transform, that would modernize Alberta's facility-based continuing care system. And the recommendations will improve the quality of life for residents and families. In fact, it puts quality of life right at the front, right at the center of these recommendations. And the work environment for staff and for operators, and help us to make use of better use of taxpayers' dollars. The report also takes into account the lessons of the pandemic and its impacts on the residents and their families, on the staff and the operators. And this includes updating the design guidelines for continuing care centres and targeting capital funding to support a greater variety of models to be built throughout the province. The next step will be to develop an action plan for implementation. And as you will see in the report, some of these recommendations are significant and require further analysis before we can move forward on them. We're aiming to have an action plan in place this fall, which will range from immediate actions to incremental shifts for implementation over the coming months and years. But some of them are straightforward, and we're moving forward with them right away, today. And one example would be implemented as of July 1st. Continuing care facilities will no longer admit residents into shared rooms that already have 2 residents. We call these in Alberta ward rooms. There are a number of them that still exist in the province, and by July 1st, we will no longer have ward rooms in the province. This action will result in phasing out these few remaining rooms in facilities shared by more than 2 residents. It's based on one of the key learnings from COVID-19. We've all learned the importance of physical distancing to help to reduce transmission. Multi-resident rooms are among the biggest risk factors for infection control in continuing care, for COVID, for influenza, and for any other communicable disease. So we're setting a goal of eliminating the multi-resident rooms. We've already been building new facilities with 100% private rooms, and we're going to start reducing residents per room across our existing facilities. Also, starting July 1st, we will expand public reporting on the performance of continuing care facilities to include site-specific results of the many different monitoring, inspections, and audits that occur. So some examples, there are the continuing care health service standards audits. There are also the Chief Medical Officer of Health order inspections, and there are the AHS quality monitoring visits. And so this reporting and better transparency, better disclosure to Albertans will occur by July 1st. And Albertans will be able to access this information online through AHS's Continuing Care Facility Directory or on alberta.ca. And last, we are going to keep supporting couples together in continuing care facilities as much as we possibly can. And this has been an issue for decades, regardless of COVID. It's been one of the focuses for me for wanting to do this review. It's basically, or it's basic to the quality of life for residents, and it needs to happen. These are good steps, but there is still a lot of work, important work ahead of us to modernize the system, to meet the challenges that are coming. So this report shows the need for continuing care services in Alberta will be growing by 62% by the year 2030. And findings from the review also show that Alberta will need to adjust the types and the mixtures of continuing care services that are provided in Alberta in the future. And we need to give Albertans choice of settings in which they receive the care and services that they need. To meet the growing demand, this must include increasing home care services. And the Ministry of Health is working with AHS to explore expanding access to client-directed home care options to enhance client choice as well as flexibility. And this includes a new pilot for self-directed care that's going to be coming later this year. Now, these actions are essential to promote care in the community. And I can't emphasize enough how transformative these changes will be and why it is so important for us to get these right for both our current residents as well as for us to prepare into the future for our future residents and their families. Albertans expect and Albertans deserve a person-centered continuing care system, one that focuses on the needs of the individuals who are requiring that care. And with that, I'm very pleased to, this has been our continued focus throughout the review, is going to continue to be our focus now that the review has been done and we've received the report. So thank you to everyone who has contributed to this review. Thank you to MLA Gotfried. Thank you to all of the remaining members of the expert panel. And most importantly, thank you to the residents. Thank you to the families, the staff, and the operators, and everybody else who provided their input. There were surveys, there were focus groups. 7,000 Albertans were included in being able to provide the expert panel with their input. And so thank you to all of those Albertans who participated. Our continuing care system is now ready for a whole transformation, and I'm committed to delivering it. And so thank you, and I'll now turn the podium over to MLA Gotfried. Thank you, Richard.
Great. Thank you, Minister, and good afternoon, everyone. It's been my honor in my role as a chair of the Continuing Care Review Expert Panel to support this incredibly important work, as well as informing the development and evolution of new continuing care legislation. The Minister referenced that this is a bit of a personal passion of mine, but certainly it's about the seniors in our province getting the best that they can, the quality of life they deserve, and the families, of course, that we hear from day in and day out, and as we did in this panel. I have personal experience and actually personally involved. I have 3 family members currently in various levels of continuing care. And over 25 years ago, I went through the challenge of keeping my father in his own home where he wanted to be until the day he died at age 87. It was much different then, and we intend to make it that much better in the future. I'm grateful to the dedicated volunteer panel members who have provided a diversity of perspectives and whose expertise and expert and real-life advice has been instrumental to the recommendations brought forward in the final report. So I add my thanks to that incredible group of individuals who represent, from residents to stakeholders to family members to staff across the board, and that was really an incredible process for me to be involved with, and I thank the Minister for that. The review was focused on designated supportive living and long-term care facilities. And while the objectives of the review were to assess the existing facility-based continuing care model in Alberta and to provide the government with recommendations for improving residents' quality of life, and I'll say that again, quality of life and care, while enhancing transparency, accountability, and efficiency within a system. With the release of the final report, we have reached a pivotal point in the future of Alberta's continuing care system. While building a strong facility-based continuing care system for today is critically important, putting in place a foundation that will keep it strong for future generations is every bit as important. This is why the report's findings are so important to informing this process. Minister Shandro mentioned earlier the demand for continuing care services will continue to grow in the years ahead. We know that that's the baby boomers who are at the front end of this now, roughly between 54 and 73. So some are maybe just now entering into that system, but this is a huge number of Albertans, and we need to focus on that absolutely in the time going ahead. We must be open to new ways to help us to expand current capacity and to modernize the delivery of care to enhance residents and all Albertans' quality of life. This means being willing to find better ways to provide care and supports, improving system integration and accountability, and to develop a wide range of innovative models that people can choose from. I believe Albertans are ready and want these changes to occur, and we've heard of some of those that are going to happen almost immediately. In January of this year, MNP, Myers Norris Penny, led a series of engagement activities to listen to Albertans. They consulted with continuing care residents, families of residents, facility staff, operators, non-governmental organizations, and other system experts to discover the gaps and issues within the system and to gather suggestions for improvement. We heard from over 7,000 Albertans through online surveys, and the feedback we received from over 90 virtual interviews and focus groups was instrumental in the work we did. The report captures what MNP heard from Albertans related to quality of life, client choice, and the ability to live at home longer and healthier, and the importance of self-directed care options. The recommendations made by MNP point to a transformative shift in continuing care. And they include changes and enhancements needed in designated supportive living and long-term care facilities, as well as across home and community care. MNP is recommending a greater portion of continuing care services could be delivered in the home and in the community, rather than only through facility-based continuing care. That is what we heard from Albertans. This is exactly what seniors and those needing and providing care have advocated for a long time, and we are now taking action. With a modern vision for continuing care service delivery comes the need for updated, flexible legislation, one that we can use in the years ahead, as some of the current legislation is over 30 years old. Findings from the report will help to guide the development of new continuing care legislation. Over the summer, as the Minister referenced, and into the fall, alongside the development of new legislation, collaborative work will be completed to develop an action plan outlining how to prioritize and implement the recommendations MNP has made. The action plan, paired with the new continuing care legislation, will create a solid foundation for a modernized continuing care system in Alberta. In closing, I believe we reached a long-anticipated milestone with this report. With the facility-based continuing care review underway, we are on track to make meaningful changes that will benefit all Albertans. Thank you. I would now like to invite Dr. Carol Estabrooks, one of our expert panel members, and a great person I might add, to say a few words on behalf of our announcement today. Thank you.
Good afternoon, and thank you, MLA Gotfried, for your dedication and the work that you put into this important report. I also want to thank my fellow panelists and those behind the scenes who worked to bring this report to fruition. I know my fellow panelists feel as privileged as I do in having been part of this work. It is a report of which Albertans can be proud. The recommendations in this report will be transformative for Alberta's facility-based continuing care system, and for the care of older Albertans who need care in these settings. And for the recommendations will go a very long way to eliminating the fear that many Albertans have of one day needing to place their loved one in care, and to eliminating our own individual fears of one day needing those services ourselves. The recommendations go a long way to tackling the most important aspect of any supportive or long-term care home: a good quality of life for residents and a good end of life. This means a life lived with dignity, not only without fears and free from pain, agitation, restraint, pressure sores, and depression, but with the experience of life quality, feeling safe and loved, having choice, having enough human touch, enjoyment, and laughter, experiencing the sights, sounds, and tastes that bring all of us pleasure, whether those be in high-quality food, sunshine on our faces, laughter with others, a beer, or a cup of fresh, aromatic coffee, not being in a wheelchair all day, hands in garden dirt, or holding a beloved animal, or interacting with children as a normal part of life, participating in familiar cultural and religious practices, feeling good about how you look, safety from discrimination, and not having to hide who you are. These are the stuff of quality moments, and our job is to create the conditions that will make enough of those moments to make a good life and a good end of life. The recommendations also tackle the most commonly voiced concern in Alberta or anywhere in Canada: inadequate resources, starting with the critical frontline workforce. Those care aides on the line every single day who not only provide basic care, but who form meaningful relationships with the older adults in their care, who in many cases wrap these vulnerable and wonderfully diverse older adults who have lived rich and meaningful lives into their idea of extended family. Every single member of the workforce in care homes, from director of care to manager to nurses to members of the allied professions to the dietary, cleaning, and mechanical staff, does honorable work. Every single one. But it is the care aides who are there for the moments, day and night, in the most intimate of times, to care in the most expanded understanding of what care can be. For that, for being those in whose company we leave our loved ones, much is owed. This is an important beginning to supporting them to do what we cannot do ourselves for our loved ones, and it is time. And it comes at a critical time. Alberta is currently among the youngest of the Canadian provinces and territories, but this is set to change rapidly over the next 20 years as we live longer. We have a rare window in which to prepare, and the recommendations in this report give us a roadmap to do just that. These recommendations will position us as a national leader in transforming facility-based care for older adults, the majority of whom have some form of dementia. They make a critical contribution to the care of people with dementia at the too often neglected late stage of life. Nowhere in Canada have I yet seen recommendations as bold and with such transformative potential as these. Thank you.
Thank you, Doctor. And I have to say, when you were listing those moments, I mean, how touching that is to hear those. So thank you. And thank you for being involved in the report and for those kind words. I also just want to start off by noting, typically you would know that we try to offer technical briefings for an announcement like this. I understand that inadvertently there wasn't one provided for this announcement, so I just want to note the error and apologize, and we'll anyways make sure we answer any questions today or after today's announcement that we can for anyone on the line. So with that, Steve.
Yep, thanks, Minister. So we'll allow all the time we can for questions.
Yes.
Bearing in mind it's a House day, so I'll ask reporters to limit yourselves to one question off the top and one follow-up, but we'll get as many in as we can. So with that, first question, please.
Dean Bennett, Canadian Press.
Hi, Minister. Can't imagine with the experience that you have and Steve Buick has and your Chief of Staff, no one thought with a 200-page transformative report, no one thought, gee, maybe we should have a tech briefing so that the people who can ask questions on behalf of Albertans can ask informed questions. So I'll ask you again, what really happened here? I'm sorry, sir, I'm not buying it. I'm inadvertent. You guys have got too much experience. Why did you not hold a tech briefing?
Sure. Well, ADM Romano, I see ADM Romano coming up. Sure. Yeah. Maybe I'll just let ADM Romano come up to speak. I have to admit, Dean, I just found out myself just before, so or while Dr. Asterbrooks was speaking. So.
I think in response, and I'm ADM Evan Romano of Health Service Delivery leading on this work, I think the nature of this report and the approach building on the advice from MMP is really to develop over the coming months the action planning process. So there's a signaling, as the Minister outlined, with the intentions to proceed in a couple areas, but absolutely the formal confirmation based on the advice from MMP is very much something that the Alberta Health Ministry, along with Alberta Health Services, and other partners in community, Albertans will be engaged to confirm the details for implementation, looking at the funding implementation considerations, etc. So I think that's the nature of this approach, rather than all of these elements being implemented immediately. It's different than other reports, and hopefully that responds. But certainly if there are more technical questions, the Ministry is happy to respond in a more technical way as required.
Thanks, Evan. So follow-up, Dean?
Yeah, no, I don't buy any of that. I've been doing this for 2 decades now. So my question again, Minister, is you guys did discuss whether or not to have a tech briefing. You decided not to. Why not? And if you're not going to have one, will you commit to standing up tomorrow so that we can have a chance to review this 200-page, as you say, transformative report and ask you informed questions?
Well, a couple of things. I did not make a decision to not have a tech briefing. I was advised that there was a concern that there wasn't one while Dr. Asterbrooks was speaking, so I wanted to start off by noting that error. And I'm very happy to speak again tomorrow. If folks would like to speak to me again, whether it's through INS or again, I don't know if there's who's booked this room, if there's an opportunity to do this tomorrow. I know that there are also an announcement that Dr. Hinshaw and Premier are involved in, so we'll try to coordinate something. I'm very happy to be able to have another opportunity to answer questions after today, if you like that, Dean.
Okay, thanks, Dean. We'll go to the next question.
Lisa Corbella, Post Media.
Okay, so yeah, I haven't read the report, and anyway, my question is, will there be capital funds, and how much will those capital funds be for organizations who run long-term care homes to update some of their homes, which in some cases are like 50 years old, and of course were built in a more sort of hospital-like way in the olden days. Now they're more home-based. They seem more like condos almost. But so just wondering what kind of capital funds are going to be made available to help update these facilities that in some cases are, older than 50 years.
Yeah, fantastic question, because a lot of our inventory was, as you said, built in the 50s and 60s. The ASLI program, if you remember, was two previous governments ago, and it provided capital grants through operating dollars to operators, the independent providers, to be able to build more spaces on a 50% basis. And the ASLI program was terminated under then the next previous government. We did announce, it was a commitment for us in the campaign to bring back ASLI. A different version of it, admittedly, because what we're trying to do is have 4 different phases in this ASLI program. So the first one has begun and is soon concluding, and it's a no capital phase of the ASLI program, for where government isn't providing capital funding through operating dollars to these new spaces. And so once that is completed, we'll be able to proceed with the next 3 phases. One of them is an Indigenous phase. One of them is similar to the previous ASLI programs, but for providing capital grants. And then the third one, or the fourth phase, but the third one remaining to be announced, is one that will help us with refurbishment of the current spaces, and that'll include being able to bring some of these spaces up to the new design guidelines, which are being amended as a result of what we've learned from COVID. Thanks, Leisha.
Follow up, Leisha?
Yeah. So, with regard to sick leave, do all long-term care workers, and I'm including like the people who clean and all of them, do they all have paid sick leave? And if not, when is that going to be implemented? Because we know that was a problem of sick workers coming into work and then spreading that to residents. So I don't know where the province is on that.
Well, I know there are a bunch of different operators. AHS is one of them. AHS operates about a third of our continuing care, facility-based continuing care beds. But maybe, Adium Roman, do you mind? Because I see, do you mind if I'll pitch this answer to you?
So just with respect to those questions which are more labor-related, certainly the report that's outlined here is forward-looking elements related to the workforce and needs of the workforce into the future. It looks at some of the lessons from the pandemic, but again, this is very much what we as government and with partners and operators will be digging into more specifically. So with respect to specific questions or comments that sound maybe more site-specific, we could take technical questions away and work with colleagues at the Ministry of Labour to respond. But again, the context of the facility-based continuing care review report is really what does the workforce of the future need to look like to better support Albertans, and that is where government will respond in the months ahead with the action planning process.
Thanks, Evan. We'll go to the next question.
Kevin Minnick, CTV.
Hi there. Question first for Minister Shandro. Manitoba announced it will give people who got the AstraZeneca shot an mRNA shot for their second dose. Will Alberta follow suit?
Well, there are going to be announcements fairly soon on what we'll be doing with our second doses and offering to Albertans. Obviously, not everybody can take a messenger RNA vaccine like Pfizer or Moderna, or not every Albertan wants to either. But for those who would like an option, I think Dr. Hinshaw will be making an announcement soon regarding the second doses. Originally, we were hoping there was a study that was being done in the United Kingdom. It had 2 parts. The first part was on safety, and it's been determined that at least it is determined to be safe. We were waiting for the second part to have been completed. We were hoping it would have been done last week, or announced, at least publicly released last week. It's not going to be released now, don't think, until the end of June. So we'll have to be moving forward, like other provinces, to at least provide the best information that we can. There's also another study in Spain that will help inform these decisions. So there'll be an announcement soon on this, Mike. Thank you. A follow-up, Mike?
Oh, it's Kevin, actually.
Oh, Kevin. Sorry, Kevin. Sorry.
That's okay. Why is it that Alberta still hasn't announced its second dose plan when so many other provinces have had theirs for over a week now?
Well, a couple of things. One is because other provinces are far behind us in second doses. I mean, you have to remember that back in March, actually back in February, when people started making their first as well as their second dose appointments. Unlike Ontario, for example, which canceled those second dose appointments, we honored those appointments that were made before March 10th. So we are much further ahead than other provinces. As you notice, there are many provinces are just starting to make second doses available to people who are over 80, as an example. So we are further ahead. Many of our folks in phase 1 have already had that second dose, but we will be making those announcements soon as well. And look forward to that being the case. We got to make sure that these decisions are based on fairness, on equity, on the best way for people to understand the availability for those second doses, and so those decisions will be coming soon.
Thanks, Kevin. It looks like we've got 3 reporters waiting in the queue. We'll try to get to all 3 of them, so we'll go to the next one, please.
Carly Robinson, City News.
Hi. Again, I haven't had a chance to read the report, but you mentioned the 6 staff that lost their lives. Could you elaborate on what's being done to honor them and prevent this from happening again if there's another deadly virus in our healthcare system?
Thank you. Well, a lot of it is being able to move forward right away on these design guidelines to make sure we're learning from COVID. And the design guidelines that are used to instruct on how future spaces are built will be using what we've learned. There's also, as Evan mentioned when he spoke to this, the recommendations also include recommendations on increased number of care hours, increased mental health supports for residents, but for the staff also changing the availability for staff and the mixes in a unit or in a facility to be able to provide that care, and so that's going to be incredibly important for those staff members. So about half of these recommendations we'll be able to proceed with immediately. The other half will be going to the fall as we take a look at some of the bigger HR and monetary implications for those latter half of the recommendations.
Was there a follow-up?
Yeah, can you elaborate on some of the recommendations that will start right away and some that are going to be waiting?
Sure. So, probably the biggest one that we're proceeding with right away is getting rid of our wardrooms in the province. So there's about 50 of these wardrooms that can have 3 or 4 residents in them. So we'll be transitioning those residents and not having anything more than semi-private rooms throughout the province. There is a recommendation as well that we move and transition to private only. And so we'll be looking at that. That's not something that's going to be moving right away, but transitioning those 50 wardrooms into just being semi-private going forward is probably very significant. Another significant one is now moving forward with the expectation that loved ones can grow old together and live together in these facilities, and the expectation that operators will be able to accommodate that. We'll also be, as I said in my remarks, the enhancing the public reporting of the inspections and the audits that happen. There's a bunch of different organizations that do inspect and monitor and audit these facilities, so we'll be providing more robust disclosure starting on July 1st. What else are we doing right away? We are updating the guidelines, as I said. There will be capital grant funding to support Indigenous organizations that previously weren't successful in their applications for ASLI applications for continuing care services in communities where they live, and expanding community care as well through some of the what we've learned internationally. Other provinces, as well as some of our zones, are providing home care differently than other zones. So taking a look at where we're most successful with how home care is being implemented and being able to expand that choice for residents to be able to receive home care where they live rather than having to go into facility-based continuing care. So that's a highlight of maybe about 6 of them.
Thanks, Carly. We'll go to the next question, please.
Michelle Belfontaine, CBC.
Oh, hi there. I also want to express my extreme frustration and irritation at the fact that we are being given a 217-page report. I mean, I haven't even had a chance to listen to the answers during this news conference because I'm too busy trying to scroll through the report, where I had to find the link myself online. Anyways, that aside, recommendation 21, there is something in here about establishing a full-time employment benchmark for nursing, therapeutic, and healthcare aid staff as one of the quality indicators. And also there is a note about the fact that too many people in long-term care and designated supportive living are part-time. So I'm wondering what commitment the government has to remedying the situation.
Yeah, so this is going to be one of the recommendations. We're going to go away, take this recommendation, develop an action plan through Evan's division, and come back in the fall for how the remaining half of these recommendations will be actually implemented. Because that's a great question. The report is thoughtfully providing us with the opinion that these things need to change, that we need to move to these benchmarks, that we need to transition the continuing care system, the facility-based continuing care system, into this direction. But as you pointed out, Michelle, how does it happen? So what we're doing is those ones that need the question to how to be answered, we will take those away and then be coming back with that action plan in the fall. Thank you.
Thanks. Follow-up, Michelle?
Are you committed to funding this, to funding a change so more people are full-time in the system?
Well, Michelle, I'll say this. I mean, this has been incredibly important for me. I'm so excited by this report. So maybe through my smiles and my excitement, you'll be able to tell. But this has to go through the proper channels. Obviously, it'll have to go to cabinet for any of the significant monetary implications. But I'm looking forward to working with the ministry on how the action plan is developed and how we can move forward with these recommendations. So I'll say that much. I'm very excited by this report, very proud of this report and the work that the expert panel has done and the amazing work that they've done.
Thanks, Michelle. We'll go to the last question, please.
Catherine Gregowski, Alberta Today.
Thanks for taking my question again. This may be answered in the report, not too sure, but I'm having a difficult time reconciling the goals that are about increased staffing and improved quality of life, while at the same time ensuring sustainability in the system and trying to cut back on operating costs. So can you explain how those two goals are working together?
Well, there's no recommendation for anybody to cut back on operating costs. Look, the way that operators, whether they are AHS or an independent provider, are funded is through either through grants that we provide to AHS. If it's an independent provider, they have contracts for the care that they provide to a resident, and so they will get the funding from AHS, or there are accommodation charges for, it's supposed to cover everything that's non-care related. So we have expectations on the quality of care that's provided to these residents, and by having a report that's focused and putting right up in front, as Dr. Esbrooks actually said to me before this announcement, putting quality of life as front and center is probably one of the most significant parts about this report, and it I think is going to continue for this province to move towards not move towards, but to continue to improve the care that's provided these residents in their where they live in these facilities.
So thanks, Catherine. I think MLA Gotfried wanted to supplement.
Oh, yeah, sorry.
Just take a minute for him.
Thanks, Steve.
Just wanted to supplement what the minister had noted. Some of, as you'll find as you look through the report, there are other opportunities for us, digital health and using technology and innovation. Also, some of the pivoting towards more home care. So there's going to be some ways for us to ensure the sustainability through, if you look through the detail and the recommendations in this report, there's going to be many ways for us to innovate, for us to deliver services differently, and to provide that sustainability going forward. So I think as much as this may be about about the funding and the financing. A lot of it is about how we deliver, how we build the facilities, how we ensure that they're embedded with the digital health opportunities to supplement and complement and to allow us to have greater time people to people by using that technology and even artificial intelligence in some cases to monitor vitals, but also that shift into the home care model, which allows us then to provide a choice and different types of care as well. Thank you.
Thank you, Richard.
Yeah, thanks, Richard. So, Catherine, supplemental for the final question?
So fees were a big concern that was raised from the outset of the report. Additional accommodation fees, fees for medication, depending on the level of care. What's going to change in terms of fees charged to residents in continuing care?
Fantastic question, Catherine. So this is going to be one of the recommendations that we'll have to wait for that action plan, and I'm very interested in hearing from residents and families throughout the province on that particular recommendation, and it'll need to proceed to that action plan, and whether and to what extent we proceed with that, we'll wait for that action plan. Thanks, Catherine.
Thanks, Minister. We'll wrap up the news conference there, but I gather the department has put together an opportunity for supplementary technical questions for media later today. So reporters, watch for a notice on that coming soon, and we'll go ahead with that this afternoon. So thanks everyone for now, and we'll talk to you again this afternoon.
Okay, thanks everyone.